Hello, this is Dr. Do again. This video continue with alphabetic list of problems with the letter N. Today I'm going to continue with the nausea. Previous video I talked about the nausea in different age groups. What are the causes or what kind of emergency signs associated with this nausea, or what are the serious complications associated with this nausea. Today I'm just going to talk some details, what kind of nausea really indicate serious problems. Even though it's not emergency, you have to take serious to see a physician. Because let me just, because I have mentioned about what kind of signs associated with nausea, you need to visit the emergency on previous video. So today I'm not just going to skip that part. If you think it's necessary, important, please follow up the previous video. But today I'm going to talk about the serious causes of this nausea, in addition to just the stomach flu or lack of resting or stress or dehydration cause this nausea in healthy people. But in general, what are the causes for serious problems associated with this nausea from head to toe? If you think about the nausea, regardless of the age, if the nausea continuously going on and cannot be improved by the home remedies like drink some water or take some naps and recover from the fatigue or stress, if still cannot go away, then these are the serious causes. First of all, the medication. Are you taking any medication for those who either over-the-counter have been healthy, but over-the-counter medication, for example, Motrin or Tylenol, all of them can cause nausea, especially if you continuously taking them for a long time, can cause liver damage, and then that definitely can cause the nausea. Or in addition to the medication, all the prescription medication, your physician probably told you some of the medication can cause this nausea, vomiting. But if it is really the nausea does not go away for a long time and cannot feel not tolerable, so then you need to talk to your physician to switch other medications. And the other, now let me just, in addition to these chemicals and medication, of course some chemicals like alcohol, smoking, they either withdraw or overdose, they all can cause this nausea. Let me talk about the diseases, really organic diseases that are associated with this nausea from the brain. Any disease in the brain cause nausea by the increased cranial pressure. Intracranial pressure can be increased by many causes, either the hemorrhage or stroke or tumor. They all can cause this increased intracranial pressure, and that can cause the nausea. And also just the idiopathic elevated pressure inside of the skull in the brain for young female, obesity, and can have this kind of idiopathic increased pressure inside of the brain. So these are all can also be associated, presented as nausea. And also the eye diseases, different kind of eye diseases, or increase the pressure of the brain and also increase the pressure in the eyes, can also have this nausea. Or the simple problem like the refractory problem, if your eyes cannot see clearly, or if your glasses does not fit, they all can cause this nausea, dizziness. So it's quite common from, and also the ear disease, like for example the Meniere's or any kind of ear disease, particularly the ear disease associated with the cochlear or the vestibular nerves. So the nausea associated with dizziness. So a variety of causes. Then what are the signs? What can you tell whether it is organic disease or it's just a transient dehydration or lack of sleep? Like I said, if the nausea associated with other symptoms like dizziness, nausea, headaches, or fever, with or without fever, and you cannot correct it, or so that if that's the case, see your physician to discuss about this nauseation. And after this, from that, and also heart disease, of course, some of the serious heart disease, like a myocardial infarction, can present it in subtle symptoms, or ischemic attack, doesn't have angina. They all can associate with this nausea, but usually, if that's the case, they associate with the chest pain or other symptoms or pre-existing systemic diseases. And of course, digestive system disease is one of the most common cause of nausea. The common stomach flu or ulceration, gastritis, gag, GERD, all of those can cause this nausea. I already talked about those common digestive system disease. So if you have those symptoms, of course you need to talk to your physician, even though it's not urgent condition. And the other important, of course, very serious causes of nausea is liver disease. Liver disease from hepatitis or caused by the hyperlipidemia, alcohol, chronic viral infection. They all have this subtle nauseation at the beginning. For example, hepatitis B or hepatitis C. Hepatitis A, I think, is one of the most common cause of nausea in the liver disease, viral caused liver disease. However, hepatitis A is really occurring in endemic area. It's not common in the United States, so not worry about that much. But if it is the hepatitis A infection, nausea, vomiting, jaundice, that's acute, and it's compared to the hepatitis B or hepatitis C, this latent period is short for hepatitis A, so immediately with the symptoms. However, like I said, it's not common. And hepatitis B, hepatitis C, that's the subtle infection caused by the virus, can have this nausea. So that's also another sign. Or if you have risk, if you work in health facility, or if you have other risk factors, if you develop this nausea, may or may not have jaundice, talk to your physician. The other cause, of course, pancreatitis. It's quite common, particularly in middle-aged with stone or alcohol. This hepatitis, pancreatitis, on top of the hepatitis, or they can occur together. But I'm talking about the isolated pancreatitis, can have this nausea, usually associated with dull or sharp epigastric pain, not like different from the stomach ache, or just feel the very sharp pain of the upper gastric area if you have the risk factors again. And the other important, I think, very serious cause for this nausea is kidney disease. You may know it, you have chronic kidney disease, or you may not know it suddenly, or not suddenly, just gradually you feel this nauseation with, of course, if that's the case, you usually have other symptoms like edema, or feel sluggish, abnormal electrolyte balance. So these are all the serious problems that can cause this nausea. That I think you probably know it. The take-home message is, if you have this annoying, nauseated feelings, either from the dizziness, or have dizziness or chest pain, or feel swelling, just and if you try something at home not help you, so then the take-home message is talk to your physician. Maybe just the subtle caused by the medication or some stress, but like I said, especially for older people, if you have this long-lasting nauseation, then talk to your physician. Maybe something serious is going on. So physician will talk to you, collect your history to test, to diagnose, and to exclude if it is nothing going on. So that's what we all hope. But I'm going to stop here, and thank you for watching. I will see you next time.